Have you ever wondered what the future of medicine might look like? Well, let's take a leap into the future, where we glimpse into a world revolutionized by regenerative medicine. This innovative field is not science fiction, but a rapidly burgeoning reality that promises to redefine the landscape of healthcare. So, what exactly is regenerative medicine? It's a groundbreaking branch of medicine that focuses on replacing, engineering, or regenerating human cells, tissues, or organs. Its ultimate goal? To restore or establish normal function where it has been compromised due to age, disease, damage, or congenital defects. Regenerative medicine involves harnessing the body's own healing mechanisms or using external agents, such as cells, biomaterials, and growth factors, to repair or replace damaged tissues and organs. Unlike conventional medical interventions that often focus on symptom management, regenerative medicine aims to address the underlying causes of disease and injury, offering the possibility of long-term solutions and even cures. Imagine a world where a burn victim can have new skin grown for them, where a diabetic patient can have their pancreas regenerated, or where a heart attack survivor can have their damaged heart tissue replaced. This is the world that regenerative medicine can create. Regenerative medicine is not just one technology, but a combination of several interlinked technologies. This includes numerous technologies such as stem cell therapy, tissue engineering, gene therapy, and biomaterials, which we will delve deeper into in just a bit. Each of these technologies plays a crucial role in the grand vision of regenerative medicine. We will also examine current applications of regenerative medicine such as cartilage repair, wound healing, organ transplantation, and neurological disorders. Then we'll look at some patents filed and emerging advancements in topics such as 3D bioprinting, organoids, cell reprogramming, and immunomodulation. It could drastically reduce the need for organ transplants, a process fraught with challenges such as organ shortages, organ harvesting, rejection, and the need for lifelong immunosuppression. If you have ever seen an organ transplant patient bloated from steroids that are destroying their eyesight and bones, you would understand the implications of this miraculous healing. Moreover, it could also provide solutions for diseases currently considered incurable, like Alzheimer's, Parkinson's, and many forms of cancer. But the road to this future is not without hurdles. There are complex technical challenges to overcome, ethical issues to consider, and regulatory pathways to navigate, which we will cover in a subsequent video. However, the medical community worldwide is actively engaged in research and clinical trials, pushing the boundaries of what is possible. As we look to the horizon, we see a future where medicine is not just about treating diseases, but about healing the human body in ways we've only dreamed of, by replacing and regenerating damaged parts of our body. It's important for me to say that we must live in gratitude for the second chance that we are being given by the upcoming release of suppressed technologies. Deep gratitude isn't just words, it is treasuring our bodies and connecting to all living things in a way that many never have. So let's dig deeper into this emerging technology that can revolutionize life as we know it. As previously mentioned, regenerative medicine involves numerous different technologies. We will cover a few today in this video. First, let's look at stem cell therapy. Stem cells have the remarkable ability to differentiate into various cell types, making them invaluable for regenerating damaged tissues. Researchers are exploring the potential of embryonic stem cells, adult stem cells like mesenchymal stem cells, and induced pluripotent stem cells or iPSCs in treating conditions ranging from spinal cord injuries to heart disease. Next, we have tissue engineering, which involves creating functional tissues and organs including skin, bone, cartilage, blood vessels, heart valves, and bladder, creating functional substitutes for damaged or diseased tissues and organs in the human body. The ultimate goal of tissue engineering is to regenerate tissues and organs to restore normal function, offering potential solutions for a wide range of medical conditions and injuries. Another is gene therapy, which aims to correct genetic defects or modify gene expression to promote tissue regeneration. Techniques such as CRISPR-Cas9 have opened up new possibilities for precisely editing the genome, offering hope for treating genetic disorders and enhancing regenerative processes. And the last component of regenerative medicine that we will cover today is biomaterials, which play a crucial role in providing structural support and delivering bioactive molecules to the site of injury. These materials can be natural, such as collagen and hyaluronic acid, or synthetic polymers engineered to mimic the extracellular matrix and promote tissue regeneration. And as we'll explore in the next scene, it continues to present new applications that push the boundaries of what's possible in medicine. Now, we are going to spend a little time on a comprehensive list of applications that are currently being applied for regenerative medicine techniques so that people can ask their doctors if there are regenerative treatments that could help them. First, the use of regenerative medicine techniques to promote wound healing and tissue repair in conditions such as chronic wounds, burns, and diabetic ulcers. This may involve the use of bioengineered skin substitutes, growth factors, and cell-based therapies. Next, orthopedic regeneration, including repairing and regenerating bone, cartilage, and other musculoskeletal tissues to treat conditions such as osteoarthritis, fractures, ligament injuries, and spinal cord injuries. Techniques include tissue engineering scaffolds, growth factors, and stem cell therapies. Next, cardiac regeneration can help many people by restoring heart function and repairing damaged cardiac tissue following heart attacks or heart failure using approaches such as stem cell therapy, tissue engineering, and cardiac tissue patches. The miracle of neural regeneration is another use by promoting nerve regeneration and repair to treat spinal cord injuries, peripheral nerve injuries, stroke, and neurodegenerative diseases like Parkinson's and Alzheimer's disease. This may involve stem cell transplantation, nerve grafts, and neurotrophic factors. Also, stimulating liver regeneration and repairing liver damage caused by conditions such as cirrhosis, hepatitis, and liver failure. Approaches include stem cell transplantation, tissue engineering, and bioartificial liver devices. And restoring pancreatic function and treating diabetes through approaches such as pancreatic islet transplantation, stem cell therapy, and tissue engineering of insulin-producing cells. Many elderly will be happy to know that dental regeneration is on the way, regenerating dental tissues such as teeth, gums, and periodontal ligaments to treat dental caries, periodontal disease, and tooth loss. Techniques include dental stem cell therapy, tissue engineering, and bioactive materials. Our sight is so important, and now we are restoring vision and treating ocular diseases through approaches such as corneal tissue engineering, retinal cell replacement therapy, and optic nerve regeneration. Next, vascular regeneration, which involves engineering blood vessels and promoting angiogenesis to treat vascular diseases, ischemic conditions, and peripheral artery disease through bioengineered vascular grafts, endothelial cell therapies, and growth factor delivery systems. Next, regenerative immunology, or modulating the immune system to promote tissue regeneration and reduce inflammation in conditions such as autoimmune diseases, inflammatory bowel disease, and organ transplantation. This may involve immunomodulatory drugs, regulatory T cells, and engineered immune cells. Imagine cancer regeneration by developing regenerative approaches to repair tissue damage caused by cancer treatments such as chemotherapy and radiation therapy. This includes strategies to regenerate bone marrow, gastrointestinal mucosa, and other affected tissues. Aesthetic regeneration using techniques for cosmetic applications such as skin rejuvenation, hair regeneration, and breast augmentation. This includes stem cell therapies, growth factor treatments, and tissue engineering of adipose tissue. And lastly, reproductive regeneration, which addresses infertility and reproductive disorders through techniques such as ovarian tissue transplantation, endometrial regeneration, and spermatogenesis from stem cells. I know that there are many asking, where can I get this regenerative treatment now? Well, the next segment is a list of places where regenerative treatments can be found in various healthcare settings. Many cutting-edge regenerative medicine therapies are developed and tested in research institutions and academic medical centers. Clinical trials may be conducted at these institutions to evaluate the safety and efficacy of new treatments. Some more established regenerative therapies, such as stem cell transplants for certain blood disorders or bone marrow transplantation, are offered in hospitals and specialized clinics. These facilities may have multidisciplinary teams of physicians, surgeons, and researchers dedicated to regenerative medicine. There are also specialized centers and institutes focused specifically on regenerative medicine and tissue engineering. These centers may offer a range of advanced therapies and procedures, including stem cell therapies, tissue engineering, and personalized regenerative treatments. Several biotechnology and pharmaceutical companies are developing regenerative medicine products and therapies for commercial use. These companies may conduct clinical trials that you could participate in. Participating in clinical trials is a way for patients to access investigational regenerative treatments. Clinical trials are conducted at research institutions and clinical centers, and they offer patients the opportunity to receive cutting-edge therapies under the supervision of medical professionals. In some cases, patients may seek regenerative treatments abroad at international clinics, particularly if certain therapies are not available or approved in their home country. Medical tourism destinations may offer a range of regenerative medicine services, but patients should carefully research the credentials and reputation of the providers. Patients interested in regenerative medicine treatments can consult with their primary care physicians or specialists to explore available options. Physicians may refer patients to appropriate specialists or facilities offering regenerative therapies based on their specific medical needs. It's essential for patients to thoroughly research and understand the potential risks and benefits of regenerative treatments before pursuing them. They should consult with qualified healthcare professionals to determine the most appropriate treatment options based on their medical condition, individual circumstances, and treatment goals. Additionally, patients should ensure that any regenerative therapies they consider have been rigorously tested, approved by regulatory authorities, and administered by qualified healthcare providers. There is a need for regulation and control of distribution. Someday I'll do a video on the things I saw when I was a field agent for the state of Florida. It made me cry. Chemo that is supposed to be refrigerated, stored in metal storage buildings in the hot Florida sun, and counterfeit drugs. Trust me on this. Make sure you go through legitimate channels. So, what does the future hold for regenerative medicine? As we gaze into the horizon of regenerative medicine, a world of limitless potential unfolds. The ongoing research in this field is nothing short of revolutionary, promising advancements that could change the paradigm of healthcare. Scientists around the globe are diligently working to push the boundaries of regenerative medicine. New techniques are being developed, novel materials are being explored, and promising therapies are being tested. Here's a list of upcoming and future advancements in regenerative medicine. Organoid technology. Advances in organoid technology allow the generation of miniature, three-dimensional organ-like structures from stem cells or tissue-specific progenitor cells. Organoids hold promise for studying organ development, disease modeling, drug screening, and potentially for transplantation in the future. Bioprinting. 3D bioprinting technology enables the precise deposition of cells, biomaterials, and growth factors to create complex tissue structures. Future advancements may lead to the fabrication of vascularized tissues and organs with patient-specific geometry and functionality, enhancing transplant success rates. Gene editing. CRISPR/Cas9 and other gene editing technologies offer the ability to precisely modify the genome of cells for therapeutic purposes. Gene editing holds potential for correcting genetic mutations in stem cells, engineering cells with desired therapeutic properties, and enhancing the efficacy of regenerative therapies. Exosome therapy. Exosomes, extracellular vesicles released by cells, have emerged as promising therapeutic agents in regenerative medicine. Future advancements may focus on harnessing exosomes for targeted delivery of therapeutic cargo, such as growth factors, microRNAs, and proteins, to promote tissue regeneration and repair. Immunomodulation strategies. Immunomodulatory approaches aim to regulate the immune response to enhance tissue regeneration and reduce inflammation. Future advancements may involve the development of cell-based therapies, biomaterials, and small molecules capable of modulating immune cell activity for improved regenerative outcomes. Biomimetic materials. Biomimetic materials mimic the structural and functional properties of native tissues to promote regeneration. Future advancements may include the design of smart biomaterials with dynamic properties that respond to environmental cues and support tissue growth, remodeling, and integration. Organ-on-a-chip technology. Organ-on-a-chip platforms replicate the physiological microenvironment of organs in vitro, enabling real-time monitoring of tissue function and drug responses. Future advancements may focus on enhancing the complexity and functionality of organ-on-a-chip systems for drug discovery, disease modeling, and personalized medicine. Tissue targeting and homing strategies. Strategies to enhance the targeting and homing of therapeutic cells and factors to specific tissues hold promise for improving regenerative outcomes. Future advancements may involve the development of engineered cells, nanoparticles, and biomaterials with enhanced tissue-specific targeting capabilities. Bioelectronic medicine. Bioelectronic devices, such as neural interfaces and electroceutical implants, modulate electrical signals in the body to regulate biological processes and treat diseases. Future advancements may explore the use of bioelectronic medicine in combination with regenerative therapies to enhance tissue regeneration and functional recovery. Personalized regenerative medicine. Advances in genomics, biomarker discovery, and computational modeling enable personalized approaches to regenerative medicine. Future advancements may involve the development of patient-specific regenerative treatments tailored to individual genetic makeup, disease characteristics, and response to therapy. Artificial intelligence and machine learning. AI and machine learning algorithms can analyze large data sets, predict therapeutic outcomes, and optimize treatment strategies in regenerative medicine. Future advancements may leverage AI to accelerate the discovery of novel regenerative therapies, optimize tissue engineering protocols, and improve patient outcomes. Regenerative rehabilitation. Integrating regenerative medicine with rehabilitation strategies holds promise for enhancing tissue repair and functional recovery following injury or disease. Future advancements may focus on developing personalized rehabilitation programs that complement regenerative therapies to optimize tissue healing and restore mobility and function. These upcoming advancements have the potential to transform the field of regenerative medicine, offering innovative solutions for tissue repair, organ replacement, and personalized healthcare. Continued research, collaboration, and investment in these areas are essential to realize the full therapeutic potential of regenerative medicine. So, where does that leave us? We've journeyed through the fascinating world of regenerative medicine, exploring its inception, evolution, and what the future holds. Please understand that this video did not cover energy regenerative healing because it's been covered in other videos and this one got way too long. Just let me say that regenerative medicine is skyrocketing along with many other technologies. There is always a risk when altering the body, so be sure to weigh the risks against the potential benefits. Also, there are likely to be many unscrupulous people making money by ripping others off with this terminology, so be on guard. Research everything you can about a new technology and the person that controls it. I would bet that many of the same big players own controlling interests in this technology, so do your homework. Regenerative medicine, with its potential to replace and regenerate human cells, tissues, and organs, truly embodies the future of medicine, but only when used responsibly by qualified professionals. Healing is not always easy, but it doesn't have to kill you.